supports, and ultimately decisions made between the doctor and the parent guardian with the child. Now, the question that one struggles with is, how do you translate this now? How do you translate this? And let me just share one strategy with regards to the child welfare population. You're not going to ask me about the tragedy of Gabriel Myers and the aftermath of that, are you? I mean, is that something on your mind? No, I mean, if you weren't, I'm not going to engage in that either, because there's a lot that's happened. You're probably aware of the 7-year-old cherubic, bright child who died, was hanging, if you will, 7-year-old, about 7 months ago in the Fort Lauderdale area. And because of the terrible nature of this child, of what happened to this child, who was, you know, in foster care, a ward of the state, if you will, the state appointed a 6-member panel to look into the circumstances of what happened to Gabriel, with the hope that we could address the issues that may have contributed to that unfortunate occurrence. Tragic occurrence. Lovely child. Well, the conclusion of that particular group was that many different factors contributed. But the ultimate reason why this tragedy occurred was reflected as system failure. It was a failure of system integration. It was a failure of communication. It was a failure of delineation of responsibilities. A number of people, some people did the wrong thing. Okay, the case manager, for example, was not writing honest notes, and so the records maintained by the case manager. And this is all part of the public record. And so, if any of you is interested, there is a site on DCF which basically tells you about the testimony received and the conclusions of with regards to Gabriel Myers. But by and large, people were doing the right thing. Now, one of the things that was seen with regard to Gabriel was, at the time of his death, he was on 3 different psychotherapeutic medications. Well, 2 actually, but 3 active ingredients. He was on a stimulant, and he was on Simbax, which is really a combination of 2 medications, olanzapine and fluoxetine. And there were concerns about the appropriateness of the use of that medication and whether that particular treatment combination may have contributed in part to what happened to Gabriel. Impossible to ascertain if medications contributed at all, but if they did, they were a very, very small aspect of what happened to Gabriel. It was really a system failure, and everyone on that committee agrees that that's exactly what it was, as we were really impressed by the powerful testimony that we received from multiple sources. But as we were conducting this review, we realized several things. One, no consent. No one had authorized many of the treatments, many of the medications that Gabriel had received. He was receiving them, but no one had authorized them. The next thing, when we did a review of children in foster care, we noticed that approximately half, according to the information we had, of children in foster care, really the process of authorizing treatment, there were problems. Either it had not been authorized, it had not been adequately authorized, there was a problem. Now, the third thing that we recognized was that in the context of treatment, going back to this issue of treatment in conjunction with other treatments, Gabriel was receiving a whole host of other treatments. But there was therapy, there were interventions at the school, but there was no communication between the treating doctor and the therapist. There was no communication between the therapist and the school. I apologize. So essentially, although a lot of good things may have been happening, there was no coordination at all. Now, what should be done with regard? This is the struggle in the public policy arena. You've got this situation. You've got this problem. Certainly, we don't want to do anything from a public policy perspective that reduces access to treatment or discourages people from prescribing necessary treatments. Dr. Kurel noted this black box warning and the impact, the negative impact that that black box warning has likely had with regards to public health. We clearly don't want to do anything from a public policy perspective that hurts children. On the other hand, when you've got this state perspective, which we all agree with, how do we translate this? And you say, well, maybe the state needs to pass some laws or some, it needs to kind of just streamline process. Well, the fact of the matter is, 4 years ago, the state did just that. 4 years ago, the state looked at this question and tried to translate individualized treatment, appropriate treatment, try to define it. Try to define the roles of the foster parent, the case manager, the physician, different players in the system with regards to their role in the context of foster care. There were tools developed. There was a medical form, a simple medical form, a 1.5-page medical form in which the physician had to fill out only half of that particular information. Fairly straightforward medical form to articulate, to at least translate some of these issues and make it simple. To basically contain at least this information in a simplified sort of way. Because the judge who is authorizing treatment, he's not a physician. He knows absolutely nothing about medication, appropriateness, etc. But the judge is the best person to look at process. So if I'm a judge, how will I know that due process has been gone through? Well, if there is a form that describes this, then I know this form has been shared. This information has been shared. This thinking has been gone through, and this information has been shared with relevant people. I don't know that for a fact, but if I don't see this, then I don't even know if this process has been gone through. I know it's not happening now. We saw this with the Gabriel Myers case and the review that we did. So this form was developed, a simple form. How many of you have heard of that form? How many of you have seen it? I've asked this question in a number of different settings. And less than 5%, this is a one-pager, not the new form that, the 8-pager or 10-pager that people are thinking of. I'm talking about the one-pager now. Sorry? I said I've seen it. You've seen it. So 2 people have seen it. That's good. 2 people have seen it. That's good. All right, count. 2 people have seen it. No, in this room, less than 5% of people that I talk to even know of this form, which speaks to the need for us to address this issue. Because I think we can do a lot of wrong things as we try to address this issue. There is a problem which we all need to collectively take some responsibility for and say, okay, how do we address it? Because yes, the child is a ward of the state. The court provides authorization, but it's not a paper stamp. If it's a paper stamp, then why go to court at all? So if it's not a paper stamp, the court needs to look at due process. How do we help the court look at due process? They're not experts. They can't tell you, Doc, why are you prescribing 10 milligrams of olanzapine? You should be 15 milligrams for this particular indication. They're not going to do that. They're not qualified to do that. But what they do want to know is, has this process been gone through? And if they have the relevant people who need to be informed and involved, been involved. That's all. That's a role of the court. If we can develop a process that simplifies it for the court, that simplifies it for the foster parent, because the foster parent needs information, vital information. But what should I watch for? Make sure